Take it in, but don't look down. 'Cause I'm on top of the world. Hey.
All new next, we're tackling the topic of urinary tract infections. Dr. Sharon Thompson, she's going to be with me, and she's in the open door green room. Hey, good morning. She's sharing some tips on what we can do to prevent UTIs. Looks like it's about water. We're going to tell you why they're more common now than in any other months. Welcome back, everybody. It's 8:10. Summer brings the warm temperatures, but it can also increase certain common health problems. Joining us this morning is Dr. Sharon Thompson with what we need to know. Good morning.
Good morning.
So we're talking UTIs.
Yes.
Why do we get those?
So there are lots of reasons why folks get UTIs. Men and women can both get them. They're more common in women because UTIs involve the tube that brings urine from the inside of the body to the outside.
Okay.
You can imagine men have a longer tube, women have a shorter tube.
Okay, that makes sense.
So women are more likely to get UTIs.
Okay.
But summer ratchets up that number for a couple of reasons. One,
Not drinking enough water. Yeah.
We got to get enough water.
Yeah.
So when we're dehydrated, those crystals that the kidney can form are more likely to form. You can imagine if you've ever boiled salt water or sugar water, as the water evaporates, you get more crystals forming.
Makes sense.
Well, we're no different than a pot of water.
Okay,
we get
so
dehydrated, we make crystals, and so you can get those UTIs that are from irritation of that tube.
Okay, what about our clothing? What kind of clothing?
That was the other part I was going to
Okay.
mention. Being in the swimming pool, working out more, which we tend to do more in the summer, we're more active. Moist, damp clothing can make bacteria grow more.
Okay.
And then we can get more UTIs if we don't change out of that clothing.
Okay,
So
okay.
you come from the pool, you're done for the day, get out of that wet swimsuit, you go to the gym, get out of those wet, sweaty clothes.
So wearing Daisy Dukes, that's just a myth? Give you an UTI?
You can wear Daisy Dukes if you want to, but not for too long.
Not for too long. Okay. What are the examples here that you brought in?
What I brought today is actually about kidney stones, and I don't know how well we can see these.
Okay.
I'll try to show here.
Bob's coming.
They're
We'll
different
get a close-up.
sizes because our kidneys, like I just said, concentrate water in our bodies. So if you can see my hand here, and make these little crystals, and they can be different sizes. When these crystals are passing from the inside to the outside, if you have a little tiny crystal like the sesame seeds here, that'll pass through, no big deal.
Right.
When the crystals get bigger,
When they start getting bigger,
like the pea size
when we feel
or
the
the
pain.
filbert size, that's gonna hurt.
Right.
And again, water is really gonna help to make those crystals not form and also to help them flow out of the body.
Okay.
So water is good for preventing UTIs, preventing kidney stones, treating kidney stones. And then the other thing that increases in summer is foodborne illness.
Okay, yeah,
and that's because of increasing temperatures.
Yep.
Bacteria can grow more.
Stuff is outside because you're out at the pool.
And this is where frozen water is going to help you keep those foods cool.
Okay.
Make sure you put lots of ice packs in your cooler. Keep the raw stuff away from the cooked stuff. Cook your food properly.
Makes sense.
So temperature makes a huge difference when you're dealing with food outside.
So once you get one, do you have to talk to a doctor? You can't drink something like, what is it, cranberry juice that we thought?
It depends. So if we're talking about foodborne illnesses, those usually are gonna go away on their own.
Right.
But if we're talking about UTIs, once you start getting those symptoms, the pain, the cramping, and if you've had one, you know what I'm talking
exactly
about.
what that
Sometimes
is,
you can even see some blood in the urine. You gotta call your doctor.
All right.
Cranberry juice will not work.
So hydrate, hydrate, hydrate.
And hand wash?
Hand wash, hand wash. We got it. All right. It's
That's
easy stuff. All right, Kylie, and those are painful. Hard to talk about. I mean,
how do you follow that?
I don't know.
I don't know.
Everybody's had one. Mostly everybody's had one. So, I mean, we know how difficult those can be. So that's some good advice from the doctor.
Very good advice from Dr. Sharon Thompson.